vaccination administered in the state of Meghalaya. So in the second phase, I read some other reports which said that frontline workers, including police and municipal workers, will be vaccinated. And in the third phase, I also read those aged 50 and above and those below 50 years and above will be vaccinated, especially those with comorbidities would be prioritized to receive the vaccination. Has the Department of Health received all the numbers that will require this vaccination? So has phase 3 begun? Who will be shortlisted and what will be the procedures for registration of inoculation for COVID vaccination? So there is a report which says that vaccination centers need internet connectivity to be able to identify as inoculation centers. I'd like to know what is the catch there, what is the rider there. Because as we see in almost all rural areas of the state, network issues are a main bane. So I would like to know, what are the steps taken for the smooth COVID-19 drive? What was their status of work? What efforts has the government put in to impress upon these recipients, frontliners especially, of the importance of the vaccination? I would also like to inquire, what is the stock receipt of COVID Shield vaccine in the state of Meghalaya? It was mentioned somewhere in some report that there would be an anticipated 10% wastage that had to be taken into account. I would like to know, why was this 10% wastage put in place, and what are the reasons for a vaccine to go waste? What are the shares for the army personnel from the share of the state government of the vaccine stock? I'm also aware that there are requirements for storage of vaccine. I would like to know, what are these storage facilities? I would also like to know, of all the stock that has come to the state, how many doses have been administered? I would also like to know, how many recipients have been scheduled for the vaccination? How many have refused? And who has been put into their place if government has failed to convince the recipients, so that these vaccines, which I presume have a shelf life, do not go to waste? Sir, I would like to ask, as per Government of India communication, has the Arogya Set2 app been reactivated for the registration of scheduling for COVID-19 vaccine in the state of Meghalaya? How will citizens apply for scheduling of inoculation under the Meghalaya portal? This is the time when the government has to play a very active role to ensure that this vaccine reaches to as many people across the state, in order to protect and ensure that we address the spread of the second phase that we are reading about happening in states like Maharashtra, Karnataka, and other states. So I would like to know, what are the main protocols for eligibility for inoculation? I'm also giving you first-hand information because it has happened to a member of my family. Is it true that despite completion of the second dose of the vaccine, there are reports of vaccinated individuals who have still tested positive for COVID-19 after the vaccination? Now, it is important for the government to spread information and awareness about the do's and don'ts to protect the state for the spread of COVID-19 despite having received the vaccination. Sir, I would like to ask the government of Meghalaya, are legislators of this August House not considered as frontline workers? Are we not also exposing ourselves every day to the contact of COVID-19? Why is there not an invitation to schedule MLAs and MDCs for the vaccine so that we can start and generate this confidence that this vaccine is going to be good for the state in general? What are the steps taken by the department to ensure that all of these apprehensions and myths are dispelled by the government of Meghalaya? Sir, is co-vaccine also being administered by the government of Meghalaya? And has the vaccine company published its trial reports in the public domain? With these few queries, sir, I thank you once again. I thank the Department of Health for the commendable efforts that it has put in to contain COVID and the spread of COVID in the state of Meghalaya. Thank you to all the frontline workers. Thank you to everyone who has put in an effort to contain this dreaded pandemic from increasing in the state of Meghalaya.
So, number one, the COVID-19 status as on 9 March. Since the nationwide lockdown on the 21st of March 2020, the state has come a long way. As of 9 of March, the state has had 13,977 persons infected, of which 13,815 have recovered, which is about 99%. I'm very glad to inform the House that, as on date, we have only 20 active cases in the state with our 60,000 vaccinations completed. Two, sir, why vaccinate? Vaccine is the only solution to prevent the spread of COVID-19 disease. Vaccine aim to expose the body to an antigen and provoke an immune response which can kill or block the virus if a person becomes subsequently infected without carrying the disease. Based on the guidelines from the National Expert Group of Vaccinations, COVID-19 vaccines has been introduced in a phased manner. The phase 1, focusing on healthcare workers, frontline workers, and population high risk, which is mentioned by the honorable member. Healthcare workers are the most vulnerable group. Therefore, they are the first prioritized group to get the vaccines. It may be noted that the vaccination does not ensure one is infection-free, but it will help in reducing a severity of infection if and when it happens. We should also realize the wearing masks, maintaining social distance, and hand washing are to be continued in our states. The COVID shields vaccine developed by Oxford AstraZeneca and produced by the Serum Institute India has been used till date. 3, sir, experience of the state in immunizations. Drug surveillance of COVID-19 cases in the district, continuous monitoring and supervision of infants below 1 year of age for full immunizations and immunizations of the pregnant women were done simultaneously to ensure reductions of IMR and MMR. Besides, regular review of the performance were taken up at state and the district levels. Hence, despite the pandemic and lockdown, full immunization coverage in the state has touched 92%, which was one of the top 3 highest states in the country. Moreover, the recent measles rubella vaccination was conducted for the past 2 years, where the likes of children were vaccinated in the short span of 30 to 45 days. 311 COVID vaccination center, which is mentioned by the Honorable MLA. These are the 311 COVID vaccination center had been opened in the entire states. It will be expanded up to 450 centers in the coming days. Vaccination is being taken up to the community level through the sub-center. Private hospitals have also been encouraged to provide vaccinations. 14 private facilities in 5 districts have made arrangements to provide vaccinations. 5, sir, start of vaccinations. Along with the rest of the country, COVID-19 vaccination drive in the states was launched on 16 January 2021, which 29,929 numbers of healthcare workers are registered for vaccinations. Prior to the launching of the COVID-19 vaccines, necessary preparatory exercise of the Government of India, guidelines such as dry run, sensitization program for health workers, training of vaccinators, etc., were carried out at identified station sites. The launching of COVID-19 vaccination for healthcare workers in Meghalaya was done in 10 sites. As of 11 of March, a total 63,752 vaccination shots have been administered, for which 54,749 are first doses and 9,003 are the second doses. For this information of the Honourable Member, which has mentioned during his speech. A total of 19,186 health workers have been vaccinated, with form of to 64% of the total healthcare workers. A total of 26,593 frontline workers have been vaccinated so far, which form of 60% of the entire frontline workers in the states. It may be remembered that the vaccine cannot be administered only for those lactating mothers, women planning for pregnancy or pregnant, and those who have severe allergies. Any other person falling under the age of appropriate category can be vaccinated, even for those with comorbid conditions. Common service centers, also known as rainbow centers, have been roped in for active registration of citizens who would like to vaccinate these centers and present across the state in the remote areas. I hereby call upon the honourable members, as requested by the honourable members from the Shillong East, all the cabinet ministers and all the members of the House, all the MDCs, and also the citizens to volunteer for vaccination as and when they qualify under the age-appropriate category. There is no other known way of overcoming a pandemic and need not remind the very hard time we face as humanity and as a society almost the same period last year. I would also like to urge upon the disseminate the importance of vaccination of their family members and constituents. For the age, sir, as I mentioned with the honorable member, the 60 years and above of all has to be made vaccinated. Then those who are in the 40 years and above, they need those having a comorbidity will be vaccinated. And for the third phase, for the general citizen, those above the 18 years of age, all will be given in the third phase of vaccinations. So, sir, and also would like to mention here, there's no restriction for any kind of daily food habits of anyone if we are going for the vaccinations. Minor problem might arise here and there, that also for a few hours, and the next day you will be fine, all right. I'd also like to mention here, of course, this is not a mandatory for giving vaccination, but for the own safety and for the safety of our family, I request and appeal to all the citizens of our state to take the vaccinations to prevent ourselves. With these few words, sir, I hope have been covered what all of the points mentioned by the honorable member, and also which have not been clarified are also already been noted down, and definitely we are going to respond to all the points mentioned by the honorable member. Thank you, sir.